Hello, everyone. Emily here from Fort Worth Moms, and I am so excited to welcome you to our first live Q&A, and we are so excited to have Dr. Jamie Erwin from Vivi Women's Health. Thank you for hanging out with us today. Before we get started in all of our Q&A questions, I want to go over a little housekeeping things. I have them written down so I don't forget them. So pardon my looking down and reading. Um, we do have some curated questions that we have, like we've taken from polls we've asked from our readers and whatnot, and we will be asking those, but we're also going to be looking at the comment section and we'll field some questions from the audience. You can leave your question or comment below, just like you would comment on any Facebook post. But if you want us to know who you are, you have to give StreamYard, which is the platform we're using to record this, you have to kind of give them permission, verify who you are. So you just don't pop up as like Facebook user number 1 or Facebook user number 2. And you can do that. I think it prompts you when you try to leave a comment, but it's streamyard.com/Facebook. And I will include that link in just a minute if it's not already showing up. We also want to let you know that once we have completed this Q&A session, we will download it and get it added to our Bloom classroom, which you can find on our main stage on our website. This is our virtual Bloom 2021 event. And we have lots of already pre-recorded workshops in the Bloom classroom that deal with the topics regarding womanhood and parenting for this kind of pregnancy to ages 0 to 2 of your kiddos, like this whole age and stage of life. So definitely check that out after we're finished here. Okay, I think that's all my housekeeping items. If only real housekeeping was that easy. But I am so excited to chat not only a friend of mine, but a big supporter of Fort Worth Moms, Vivi Women's Health, and also our title sponsor for Bloom 2021. Without the doctors from Vivi's Women Health, Bloom 2021 would not be as cool as it is. So thank you. So thank you, Dr. Erwin. I would love for you to just tell our viewers a little bit about yourself, about your practice, just whatever you want them to know.
Love it. Well, I'm so thrilled to be here. Thank you. Thank you for having me, for allowing Vivi Women's Health just to come alongside and partner with Fort Worth Moms, because that's what we're passionate about. We are passionate about Fort Worth and moms. So um, I am a board certified obstetrician gynecologist here in Fort Worth, office and deliver and do surgery at Baylor All Saints. And I'm in a wonderful group. There's 7 of us female doctors. It's very female oriented. Many of us are mothers ourselves, and have our own journeys through infertility, high risk pregnancies, low risk pregnancies, um, being moms, being professionals, working at home, outside the home. So, Vivi Women's Health, one of our kind of themes that you see in the way we practice medicine is that we are patients too. This is not your grandma's gynecologist. So we are right there alongside you. Um, and we are here to empower you and educate you and help you make decisions for your health. So that's really the heartbeat of our practice at Vivi. Um, and yes, we're experts in the field, but you know, we're right there with you. We're hustling, we're struggling to try to get it all done. We know what that's like, and we want to root for you, and we want what's best for you. Um, I have 2 kiddos. Georgia, age 10, is a 4th grader, and Henry he just turned 6. He's a kindergartner, and I love being a mom. I love being a wife. My wonderful husband, Charlie, has supported me every step of the way. We have been married since my first year of medical school. He was in he was active duty army when we first got married, and we've gone through some hard things together, and without him definitely couldn't be here. So and I've got family in Fort Worth. I grew up here in Fort Worth, as did Charlie. So we're so blessed to have our village of grandparents and siblings and cousins and aunts that really help us do what we do, which for me, that's my calling, is to really to be there for women and walk alongside them through some of the most um, joyous moments but also heartbreaking moments, and just to get to do life with them.
Excellent. Okay, we're going to dive into the questions, and we're going to address like the largest elephant that has ever been in any room ever, and that is coronavirus in the pandemic. And
Yeah.
um, for this very like special, sensitive, vulnerable time of life, we're talking about pregnancy. Like, how has pregnancy and giving birth changed because of the pandemic, like in the last 12 months? What do moms, think about what do moms who are pregnant now need to know about that?
Yeah. So hard. The past year has been so hard for OBs. I think, I think initially a lot of people thought that there would automatically be this baby boom, that everyone's going to be at home and making babies, And interestingly, in my practice, and other doctors may disagree, but I didn't really see that. I saw couples kind of putting the brakes on and saying, "Whoa, this is scary. This is unknown." This was before the vaccine had rolled out. We didn't know how long it would be until a vaccine um, would be available. Would it be available to pregnant women, so on and so forth. And we could definitely get in, to that, to the vaccine. But I personally did not see this huge spike in numbers of deliveries when I think everyone thought there would be. Now that we're more than a year into this, I think, and I think there is this kind of light at the end of the tunnel as we're seeing numbers go down here locally. Worldwide, that's a different issue, as India seeing just catastrophic deaths there. But locally, I think we are blessed to be in a situation where we're seeing numbers go down. um, in my practice, I'm seeing families really say, okay, life goes on. We can't kind of put our life on hold forever. If we're going to grow our family or start our family, it's, let's do this. That's not to say there's not fear and reservation. So, I think one of the hardest things is not having any visitors come alongside these our patients, and how scary. I mean, how isolating already to feel that way. Isolating because we're social distancing, and we haven't been going and doing things that normal life entailed. And so now, what if you're pregnant with your first pregnancy? You have so many questions. There's so much unknown, and now your support person isn't able to join you in the office, and that's so hard. Now, thankfully, in our practice and a lot of practices across Tarrant County, we're starting to slowly open that back up. There's some groups, that are allowing a vaccinated partner to join you. We're headed in that direction. We're slowly starting to open up to more visitors. So I think that's one of the hardest things is in a pandemic, feeling alone, feeling isolated, and that's come into play postpartum as well. I think it's setting women up for postpartum depression. At least, I feel anecdotally that we're seeing more of that because women are feeling more isolated. So I'm grateful for platforms like this, where virtually we can be together and can be encouraged and ask questions and get that support, even if it's virtually.
Yes, absolutely. I know this is a question you probably have fielded more than any other in 2021, but we're going to ask you here again. What about pregnant and/or breastfeeding moms? Should they get the vaccine? Are there risks there? Like, what are you recommending?
Yeah, such an important topic. It's all over the news. So many articles, and it's important to really be sure you're tapping into legitimate evidence-based sources. So the current recommendation, what I am guiding my patients personally and my partners at Vivi Women's Health, um, is to consider getting the COVID vaccine anytime in pregnancy. And even if you are contemplating pregnancy, if you are considering conceiving, to move forward, we feel it is safe. Um, and that what we're seeing with more and more studies that are coming out, more data, more literature that is being published, is that there are risks of contracting and being infected with the COVID, with the coronavirus in pregnancy. And we feel that those risks of having COVID infection while pregnant are higher than any, if any, risk of having the vaccine. So, vaccinations in general while pregnant, that is not a new concept. We have for years and years encouraged flu vaccine in pregnant women because they are high risk individuals. They are immunocompromised. Um, and we have for many years encouraged pregnant women get the Tdap vaccine in the third trimester, and that's for the pertussis or whooping cough component. And that is so that the baby is born with these protective antibodies against whooping cough, which newborns are very susceptible to any
Mhm.
kind of infection because they don't have an immune system yet.
Right.
So, vaccination in pregnancy is not new. And even the mRNA or messenger RNA vaccine technology, that is not new. So, taking the time to explain these, to really try to tap into what are the reservations that a patient may have as far as moving forward, and addressing those, patiently. And absolutely, a woman is going to have reservation. I mean, any pregnant woman, all she wants to do, her number one goal is to do what's best for her baby, period. And so if there's reservation in getting a vaccine, that's okay. It's because you care and you just want to be sure that this is safe, that this is really the best thing. And so I think, having that mutual respect, really trying to understand, okay, well, how can we kind of tease through some of these concerns? What is it exactly that you're worried about? Um, and providing that very evidence based information so that my patients can then go on, do their own homework, do their own research. I'm not here to tell them what to do or, judge whether they do or they don't get the vaccine. I'm here to provide that information to guide them as an expert and still take great care of them no matter what they decide. But in my professional opinion, yes, absolutely, pregnant women move forward with the vaccine. Talk to your doctor about it. Talk to him or her about what reservations you may have, if those are founded or not, and really tease that out. Um, and and then ultimately, you have to be comfortable with every decision you make while you're pregnant.
Yes, it's your parenting journey starts then. You're already making decisions for your little one. Um, Luckily in Fort Worth, I think we're really blessed to have a large pool of OB/GYN doctors to choose from. A lot of doctors in various specialties. Um, so sometimes like the burden of finding a good doctor is not so hard here, but there is like another element of wanting to find almost kind of like a home because you are a practice that is you're with women from before kids and
Mhm.
way until we're rocking great grandbabies. You're not just for the pregnant birth and postpartum stages. So like, what tips would you give to women as they maybe are searching? They're wanting to become pregnant or they are pregnant, like searching
Mhm.
for a home for their childbearing years and beyond. And I mean, you kind of talked a little bit about your philosophy in your intro, but just what are things that are important to you in a doctor-patient relationship?
Mhm. Well, that it's exactly that. It's a relationship. Um, and realize too that you may need to find a new one, and that's okay, right? Like you have a choice. I have a family member that would, only go for her well woman checkup and just kind of like, oh, I didn't like this, I didn't like that, and I finally was like, look, go someplace else then. Like you don't have to year after year settle if it's not really providing for you what you want. Find a new one. We've got so many great doctors in Fort Worth, like you said. But it is a relationship, and that in and of itself is one of the reasons I chose this field. I wanted that continuity. I wanted that longevity, um, and you know, and that's what gets me so passionate about my job. I have patients that I have been blessed to get to deliver, you know, um, all of their children, 2 or 3. I've been now an OBGYN for almost 13 years, been here in Fort Worth for 9. And I have sweet patients that I started seeing them when they were students at TCU. They graduated, they got married, and having their children now. And I love that. I love that. I didn't want to be the kind of doctor where I would only see a patient, one time, fix them, and never see them again. So it is a relationship. So trying to find a doctor that really that you click with, I should say. It is. It can be hard. So I would encourage, our viewers, first and foremost, first choice may not be your last choice. So it's okay to find what you don't want to doctor hop around your whole life, but um, you know, talk to reputable sources, talk to friends or family members, or women from Fort Worth moms who that you share certain values, or perhaps you're looking for certain things in a doctor. To me personally, I want a doctor who is going to listen to me. And that's something I challenge myself with, especially with new patients, to really shut my mouth and let them tell me their story. Um, and, we're so quick to interrupt and to get to, our questions and our agenda as doctors, right? And sometimes we think we have things figured out about what's wrong with the patient before we've even come into the room. But taking the time, taking the time to listen, taking the time to get to know, to connect, right? Like I think it's really about kind of making that connection, but also realizing that it may not, and you may have to move on and find another, and that's okay too, right? Like it's not a divorce. You don't have to like
No,
file for it. You can move on, and
no
and
one
there
will
might,
be personally hurt. No,
yeah,
no.
right. So well, and for me too, on my side of things, like I may not be for everyone. That's okay.
Yeah.
My personal side, of course, I want to make everyone happy and feel like I'm doing the best that I can, but I may not be everyone's cup of tea, and that's okay too. So ultimately it's what's best for the patient.
Yes, this is great advice. We had someone comment, "This is great advice." It really is. You know, yeah, it is sometimes trickier than we think, but we just kind of have to put some research and some effort in it. And I know that even at Vivi Women's Health, you have a number of partners, even
Mhm.
to choose from. So it is a little bit more ease of getting seen, and you share kind of the call workload and all those things.
Mhm.
We do have some workshops from some of your partners in the Bloom classroom, by the way. I think there may be 3 there. So that would be another chance if you are considering Vivi Women's Health for your health needs in this area. Head over to the Bloom classroom and you can watch their workshops. And that also gives you kind of an idea of like what's their philosophy on pregnancy and postpartum, what's their personality like,
Right.
what kind of, who do I think I would kind of gel with and mesh with. So I
One thing
will.
I'll add to that,
Yeah,
Emily, as
absolutely.
well, you know, one of the reasons that we were intentional in forming this group was we know it's important to our patients. First of all, what my patients, they want me to be there. And it breaks my heart for the deliveries that I'm not able to be there. But they also realize that I am a mom and a wife and have a family and need that time away for my own mental health to decompress and to have that integration of work, life, play balance, right? So
Yeah,
we were very much looking to form a group that we would be able to have a reproducible quality so that when I am here with you today and not on labor and delivery, I
right,
know that my Vivi partner is taking the same time and care and skill set as though I would. And
yeah,
and and I needed that
yeah, that's important.
for my patient so that I can have that peace of mind when I'm not on. And my patients needed that, as well, so that they know what they're getting. Because yeah, it is a very vulnerable time. You spend these
Yeah,
40 weeks with your doctor and you get to know them. And then, that moment, that delivery moment, um, it's so important, but I also know that walking them along through all those visits and spending that time, that was really the journey, right? Like that's
mhm,
really where the bulk of the care and the listening and the time comes from. Of course, that delivery is very important as well. But I know that my partners,
yeah,
I trust that, and that is, it's a very, it's a reproducible product, right? Like that, I
mhm.
know what they're going to give you. It's going to be what I would give you had I been able to be there.
Yes, that is definitely super important. We have links in the description for our time together here that takes you to the Bloom classroom, also takes you to our main stage for Bloom. We also put a link in for a Momfessions episode that Dr. Erwin was a guest on last year. It's called Women's Health Hotline. So take a listen to that too. She gives even like more wonderful advice there. So thank you so much. Thank you for being the title sponsor for Bloom 2021, for taking time out of your Sunday to come and chat with me and interact here with our viewers and attendees. So, from the bottom of our hearts, thanks for supporting Fort Worth moms and sharing your expertise with the women in North Texas.
It's absolutely our pleasure and our passion, and we're so happy to be a part.
All right. Bye, everyone.